This video is to give you an example of the format to use while presenting your case during the neurodiversity consult group. This format includes presenting issues, precipitating factors, predisposing factors, perpetuating factors, protective factors, followed by your impression and plan. Presenting issues is a description of the individual's presenting difficulties, including thoughts, feelings, and behaviors. Things to consider are the client's historical medical and behavioral health diagnoses, comorbidity, diagnostic criteria, disorder-specific criteria, and differential diagnoses, subtypes and specifiers for diagnoses, explanatory information and client descriptions, associated features, perceived and reported safety concerns, detail related to culture, gender, and/or identity. Precipitating factors are the triggers of the current presenting issues, which can be internal or external. Things to consider are the client's report of why now, triggers or events that exacerbated the problem, issues related to culture, gender, identity, and experiences of structural violence. Predisposing factors are internal or external historical factors which are likely to have increased someone's vulnerability to developing their current problems. Things to consider. Over a lifetime, what factors contributed to development of problem? Biopsychosocial factors, development and course of the problem, risk and prognostic factors, structural violence and historical trauma, detail related to culture, gender, and/or identity. Perpetuating factors are internal and external factors which maintain the presenting issues. Things to consider: what factors are likely to maintain the problem? Issues that the problem will worsen if not addressed, development and course trajectory, risk and prognostic factors, functional consequences, comorbidity, continued exposure to stressors triggers violence, oppression, and barriers within natural support network. Protective factors are both internal and external resiliency and strengths which help to maintain an individual's emotional health. Things to consider: client strengths that can be drawn upon, natural and social supports, available community resources, risk and prognostic factors, development and course. An impression provides a summary conceptualization based on the information provided in your formulation, focusing on how you want the reader or receiver to think or feel about the client with a justification for your plan. Consider preliminary or differential diagnoses if appropriate. And finally, propose a plan for treatment that addresses the immediate need for safety and least restrictive alternative. The following will be a case presentation example. Remember, each case consultation will have 15 minutes in total to present and consult. We recommend keeping your case presentation to no more than 5 minutes. This will give you more time to consult with fellow practitioners. This patient is a 17-year-old white trans male who presented to the emergency department via ALS after ingesting 1,700 milligrams of Benadryl in an attempt to die by suicide. Precipitating factors for our example patient include being rejected by an acquaintance he asked to attend homecoming events, feelings of loneliness, hopelessness, and helplessness. He is currently behind in his coursework and began menstrual bleeding last night. Predisposing factors include a family history of untreated mental illness and substance abuse, reported developmental delays that were never formally assessed, and patient reporting always feeling different. Perpetuating factors include recently beginning his senior year in person, being misgendered in class, no peer or professional supports, feeling like the world wants him to die, and being a transgender man in a family that believes his identity is just a phase and has not consented to patient medically transitioning. This patient's protective factors include the client's kind and thoughtful nature, his interest in connecting with providers, motivation to engage in recovery, and his desires to build a supportive community. Impressions of this patient is that he appears to be a very kind, sensitive, and thoughtful person who feels disconnected and alone, and does not see a community or future for himself. The patient's family is kind, open, and eager to learn more about patient's needs to better support him. It is likely that with a short-term inpatient hospitalization, the patient will lessen acuity to be safe to return home while the family engages in psychoeducation, systems navigation, and connection to supports with significant support from the inpatient social worker. Due to the severity of his attempts to die by suicide, his family's lack of knowledge and skills in supporting his acute needs, and his lack of current connection to mental health resources, the least restrictive intervention is inpatient hospitalization, psychoeducation for family to better support clients' needs, and connection to outpatient therapists and other supports, including a medical provider who specializes in transgender healthcare. Due to the positive correlation of gender diversity and neurodiversity, and that patient's family reported delay in meeting developmental milestones, patient would benefit from a developmental assessment by a psychologist and assessment for an individual education plan with his school. The writer provided client and family with the following resources: contact information for the Washington State Office of the Education Ombuds and a printed list of services, printed information of harassment, intimidation, and bullying from the Washington Office of Superintendent of Public Instruction, and printed About Us section from website of the organization Trans Families. Please email your 5P case presentation to le@holisticchildandfamily.org a minimum of 24 hours before the consult group. We only have time for 3 case consultations during this group, so they will be chosen on a first-come, first-served basis. Thank you so much for taking the time to watch this video. We look forward to seeing you at the next consult group.